Monkeypox. Monkeypox is a rare disease similar to smallpox caused by the monkeypox virus. It's found mostly in areas of Africa but has been seen in other areas of the world. It causes flu-like symptoms such as fever and chills, and a rash that can take weeks to clear. There's no proven treatment for monkeypox, but it usually goes away on its own. The global monkeypox outbreak has been declared a public health emergency of international concern by the World Health Organization, WHO. It is the strongest call to action the agency can make. It is the seventh time such a declaration has been made since 2009, the most recent being for COVID-19, which was given the same label by the WHO in 2020. A public health emergency of international concern, or PHEIC. It is an extraordinary event which is determined to constitute a public health risk to other states through the international spread of disease and to potentially require a coordinated international response. The UN Health Agency said the term implies the situation is serious, sudden, unusual or unexpected. It carries implications for public health beyond national borders, and that it may require immediate international attention. Monkeypox is a viral infection typically found in animals in Central and Western Africa, although it can cause outbreaks in humans. Cases are occasionally identified in countries where the virus is not endemic, but the latest outbreak has been unprecedented. While countries in Europe have been hardest hit, cases have also been reported in the US, Canada, Australia, India, Nigeria, Israel, Brazil, and Mexico, among others. In the UK, the first case was recorded in 2018 in an individual thought to have contracted the virus in Nigeria. There are two forms of monkeypox, a milder West African strain and a more severe Central African, or Congo strain. The current international outbreak appears to involve the West African strain, although not all countries have released such information. Monkeypox was discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox, the source of the disease remains unknown. However, African rodents and non-human primates, like monkeys, might harbor the virus and infect people. The first human case of monkeypox was recorded in 1970. Prior to the 2022 outbreak, monkeypox had been reported in people in several Central and Western African countries. Previously, almost all monkeypox cases in people outside of Africa were linked to international travel to countries where the disease commonly occurs or through imported animals. These cases occurred on multiple continents. According to the UK Health Security Agency, early symptoms of monkeypox include fever, headache, muscle aches, swollen lymph nodes and chills, as well as other exhaustion. A rash can develop, often beginning on the face, then spreading to other parts of the body, including the genitals, PHEIC says. The rash changes and goes through different stages, and can look like chickenpox or syphilis, before finally forming a scab, which later falls off. Most patients recover from monkeypox in a few weeks. How is it spread? Monkeypox does not spread easily between humans, and requires close contact. According to the U.S. Centers for Disease Control and Prevention, it is thought that human-to-human transmission primarily occurs through large respiratory droplets. Respiratory droplets generally cannot travel more than a few feet, so prolonged face-to-face contact is required, the CDC says. Other human-to-human methods of transmission include direct contact with body fluids or lesion material, and indirect contact with lesion material, such as through contaminated clothing or linens. The WHO said the outbreak was largely among men who have sex with men who had reported having sex recently with new or multiple partners. However, experts have stressed that anyone can get monkeypox as it is spread by close or intimate contact. The UN has warned that some media portrayals of Africans and LGBTQ+ people reinforce homophobic and racist stereotypes and exacerbate stigma. How worried should we be? The West African strain of monkeypox is generally a mild infection for most people, but it is important those infected and their contacts are identified. The virus is more of a concern among vulnerable people such as those with weakened immune systems or who are pregnant. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox. Symptoms of monkeypox can include fever, headache, muscle aches and backache, swollen lymph nodes, chills, exhaustion. A rash that can look like pimples or blisters that appears on the face, inside the mouth, and on other parts of the body, like the hands, feet, chest, genitals, or anus. The rash goes through different stages before healing completely. The illness typically lasts 2 to 4 weeks. Sometimes, people get a rash first, followed by other symptoms. Others only experience a rash. How is monkeypox diagnosed? Because monkeypox is rare, your doctor may first suspect other rash illnesses, such as measles or chickenpox. But swollen lymph nodes usually distinguish monkeypox from other poxes. To diagnose monkeypox, your doctor takes a tissue sample from an open sore, lesion. Then they send it to a lab for polymerase chain reaction, PCR, testing, genetic fingerprinting. You may also need to give a blood sample to check for the monkeypox virus or antibodies your immune system makes to it. Is monkeypox curable? Monkeypox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Most people with monkeypox get better on their own without treatment. Following diagnosis, your doctor will monitor your condition. He will try to relieve your symptoms, prevent dehydration and give you antibiotics to treat secondary bacterial infections if they develop. Antiviral drugs. Antiviral drugs may help, but they haven't been studied as a treatment for monkeypox. Several investigational antivirals with activity against monkeypox are available, but only as part of a research study. How long does monkeypox last? Monkeypox normally takes about 2 to 4 weeks to run its course. If you are exposed to monkeypox, your doctor will monitor you until the rash resolves. Is monkeypox fatal? The less severe West African clade is causing the current world outbreak, 2022. No one has died from this outbreak to date. But, monkeypox can lead to other problems or complications like pneumonia and infections in your brain, encephalitis, or eyes, which can be fatal. Vaccines for monkeypox. WHO has strongly encouraged member states to consider the use of vaccines as relevant to the national context. The monkeypox virus might have been circulating below levels detectable by the surveillance systems. Sustained human-to-human transmission might have been undetected for a period of time. Routes of monkeypox virus transmission include human-to-human via direct contact with infectious skin, or mucocutaneous lesions, respiratory droplets, and possibly short-range aerosols, or indirect contact from contaminated objects or materials, also described as fomite transmission. Vertical transmission, mother to child, has also been documented. Close physical contact can lead to transmission. It is unclear whether sexual transmission via semen or vaginal fluids occurs. In addition, the likelihood of sustained community transmission cannot be ruled out. The clinical presentation of monkeypox cases associated with this outbreak has been atypical as compared to previously documented reports. Many cases in newly affected areas are not presenting with the classically described clinical picture for monkeypox: fever, swollen lymph nodes, followed by centrifugal rash. Atypical features described include presentation of only a few or even just a single lesion, absence of skin lesions in some cases, with anal pain and bleeding, lesions in the genital or perineal or perianal area which do not spread further, lesions appearing at different, asynchronous, stages of development, the appearance of lesions before the onset of fever, malaise and other constitutional symptoms, absence of prodromal period. The actual number of cases is likely to be underestimated, in part due to the lack of early clinical recognition of an infection. It is previously known in only a handful of countries, and limited enhanced surveillance mechanisms in many countries for a disease previously unknown to most health systems. Healthcare-associated infections cannot be ruled out, although unproven to date in the current outbreak. There is a potential for increased health impact with wider dissemination in vulnerable groups. Mortality. The mortality was previously reported as higher among children and young adults, and immune-compromised individuals. It includes people living with uncontrolled HIV infection, are especially at risk of severe disease, The risk is also represented by the difficulties involved in widespread lack of availability of laboratory diagnostics, antivirals and vaccines. A large part of the population is vulnerable to monkeypox virus. As smallpox vaccination, which is expected to provide some protection against monkeypox, has been discontinued since the 1980s. Only a relatively small number of military, frontline health professionals and laboratory workers have been vaccinated against smallpox in recent years. A third-generation vaccine MVA received authorization of use by the European Medicines Agency for smallpox. The authorization of use provided by Health Canada and the United States Food and Drug Administration, FDA, includes an indication for the prevention of monkeypox. An antiviral agent, tecovirimat, has been approved by the European Medicines Agency, Health Canada, and the United States FDA for the treatment of smallpox. It is also approved for use in the European Union for the treatment of monkeypox. Clinical management and infection prevention and control, IPC, in healthcare and community settings. Patients with suspected or confirmed monkeypox require early recognition through screening protocols adapted to local settings, prompt isolation and appropriate measures. Standard and transmission-based precautions includes the addition of respirator use for health workers caring for patients with suspected monkeypox. Further emphasis should be on safe handling of linen and management of the environment. Testing should be done to confirm diagnosis and symptomatic management of patients with mild or uncomplicated monkeypox. Monitoring for and treatment of complications and life-threatening conditions are to be undertaken. They include progression of skin lesions, secondary bacterial infection of skin lesions, ocular lesions, and rarely, severe dehydration, severe pneumonia or sepsis. Patients with less severe monkeypox who isolate at home require careful assessment. It is on their ability to safely isolate and maintain required IPC precautions in their home to prevent transmission to other household and community members. Tecovirimat is an antiviral drug with recent regulatory approval from the European Medicines Agency for orthopovirus-associated infections. It includes monkeypox, based on animal models and data for safety, pharmacokinetics and pharmacodynamics in humans. Therefore, it is expected that reliable and interpretable results on its safety and efficacy will soon become available. How do you prevent monkeypox virus? A smallpox vaccine provides protection against monkeypox, but its use is currently limited to clinical trials. Prevention depends on decreasing human contact with infected animals and limiting person-to-person spread. The best way to help prevent spread the monkeypox virus is to avoid contact with infected animals, especially sick or dead animals. Avoid contact with bedding and other materials contaminated with the virus. Thoroughly cook all foods that contain animal meat or parts. Wash your hands frequently with soap and water. Avoid contact with people who may be infected with the virus. Practice safe sex, including the use of condoms and dental dams. Wear a mask that covers your mouth and nose when around others. Clean and disinfect frequently touched surfaces. Use personal protective equipment, PPE, when caring for people infected with the virus.